In this video, we'll discuss about myopathies. What is myopathy? Myo means muscle, pathy means suffering. Suffering of muscles, otherwise called disease of muscles. It is a muscle disease. Muscle can be involved many other conditions that may affect central nervous system and peripheral nervous system. In all the disease of central nervous system and peripheral nervous system, the muscle will become either weak or maybe spastic. There are sudden changes inside the muscles. But these changes are secondary to disease, which is primarily affecting central nervous system and peripheral nervous system. In myopathies, the primarily affecting muscle cells and CNS and that peripheral nervous system may not be affected. So, muscles can may be affected in the condition of central nervous system and peripheral nervous system. All the disease of central nervous system, peripheral nervous system, muscles will become either weak or may be affected. Okay, sudden changes inside the muscles. These are the changes are secondary to disease, which is primarily affecting central nervous system and peripheral nervous system. In myopathy, primarily affecting muscle cells and CNS and PNS not affected. They may be functioning is normal. Their function is normal. The primary problem or primary pathology inside the muscles. So we called it as myopathies. So here it mainly myopathy problem mainly affected muscle cells, not in central nervous system and peripheral nervous system. So that is we called myopathies. Next classification, there are two form of myopathy. One is hereditary, second one is acquired. First one is which is inherited by one of the parent go to the child. So hereditary means from parent to child. Acquired during the course of disease. This one will cause. This one hereditary further classified into 5 different type of myopathies. One is muscular dystrophy, conjunctival myopathies, metabolic myopathies, mitochondrial myopathy. Last one is myotonias and periodic paralysis. So these are the 5 different type of hereditary myopathy. Muscular dystrophy, conjunctival myopathy, metabolic myopathy, mitochondrial myotonias and periodic paralysis. Acquired myopathy, they have 4 types: inflammatory myopathy, infectious myopathy, toxic myopathy, myopathies in endocrine disease. So hereditary 5 types, acquired 4 different type of myopathies. All myopathies we will discuss one by one. First one is muscular dystrophy. It is a sudden type of common myopathy. It is a common type of myopathy. This one have Duchenne muscular dystrophy, facioscapulohumeral muscular dystrophy, then limb girdle muscular dystrophy. So this muscular dystrophy have Duchenne muscular dystrophy, facioscapulohumeral muscular dystrophy, limb girdle muscular dystrophy. These are the various type of muscular dystrophy. It is a group of genetic disease that causes progressive weakness and loss of muscle mass. In muscular dystrophy, abnormal gene mutation leads to muscle degradation. Most forms begin in childhood. Second one is congenital myopathy. Any genetic muscle disorders that is typically noticed at birth and include weakness and lack of muscle tone. Various type it have central core myopathy, mini core myopathy. It is also called as multi-core diseases, mammalian myopathy, centronuclear myopathy, myotubular myopathy. Next, myotonias and periodic myopathy, impairing disorder that resulted in that delayed relaxation of skeletal muscles after voluntary contraction. The illness, while rare, often cause that great physical and physiological difficulty for individual. Symptoms include clouding of that eyes lens, slow and irregular heartbeat, cardiac arrhythmias, and slurred speech. Coming to second type, that acute myopathy, it is further classified into four types. First one is inflammatory. That inflammatory myopathy, it involves chronic long standing muscle inflammation, muscle weakness, muscle pain, mainly caused by autoimmune disorder, body immune system that defect against the infection and disease attack its own muscle fiber, blood vessels, connective tissue, organ, and joint. So this one, because of autoimmune disorder, it affected own muscle fiber, blood vessels, connective tissue, organ, and a joint. Second one is infectious myopathy, inflammation especially of voluntary muscles characterized by localized or diffuse pain, tenderness on movement, palpation, swelling, and weakness. It affects muscle functions caused by viral infection like HIV, influenza, Epstein-Barr, Lyme disease, streptococcal and staphylococcus aureus infection. Next, toxic myopathy. It can be caused by many drugs or toxin or medication or steroid. Example, acute alcoholic myopathy and myopathy caused by lipid lowering agent. Myopathies in endocrine disease, weakness and atrophy, shrinkage of muscles around the shoulder and hip, muscle stiffness, cramp, and muscle breakdown. Causes thyroid and parathyroid disease, disorder of adrenal axis, acromegaly. Acromegaly mainly caused by endocrine disorder, mainly due to alteration in protein and carbohydrate metabolism. Third one is metabolic myopathy. It consists of acid maltase deficiency, Bombay disease, glycogenesis type 2. Glycogenesis type 2, lysosomal storage disease, carnitine deficiency, carnitine palmitoyl transferase deficiency, carnitine palmitoyl transferase deficiency. This one consists of deficiency of mainly carbohydrate metabolism, lipid storage myopathy. Fourth one is mitochondrial myopathy. It consists of a disorder that occur when structure that produce energy for all cell malfunction. A common factor among mitochondrial myopathy disease is that mitochondrial are unable to completely burn food and oxygen to generate energy, which is essential for normal cell function. It often inherited. Example, mitochondrial encephalopathy, lactic acidosis, stroke-like episode, Melas syndrome, then labor. Coming to common clinical picture, first one is muscle weakness. In myopathy, the muscle cell are disturbed. Obviously, it causes muscle weakness. Muscle weakness are symmetrical. That is, both side of that muscles affected equally. Muscle weakness are symmetrical in most of that myopathies. Some are asymmetrical. Examples: facioscapulohumeral dystrophy, McLeod syndrome, glycogen storage disorder. More often proximal involvement, limb girdle, myotonic dystrophy type 2, conjunctival myopathy, and metabolic myopathies. It is permanent. Once there is muscle weakness, it remain and continues to progress. And also sporadic. Muscle, what is sporadic? Again seen in sudden type of metabolic and periodical paralysis. Muscle weakness comes suddenly and goes. Muscle weakness suddenly will come and goes means sporadic. Permanent means the weakness it remain and continues to progress. Second common clinical picture, muscle atrophy. Muscle cells are distracted, which will lead atrophy. Because of weakness of person not able to visceral activity. In muscular atrophy can occur due to malnutrition, age, genetics, genetics and lack of physical activity or sudden medical condition. Disuse, physiological atrophy occur when you do not use your muscle enough. Neurological atrophy occur due to nerve problem or diseases. Next, pseudo hypertrophy. Pseudo hypertrophy, enlargement of muscles of that half due to their replacement by connective tissue or fat caused by dystrophy, myopathies, limb girdle, muscle dystrophy, and metabolic myopathies. So here particular part we cannot use means disuse means it will cause us, otherwise pseudo hypertrophy, enlargement of muscles because of connective tissue, replacement of connective tissue and fat. Next, muscle tone, the amount of tension in muscles. Our muscle tone help us to hold our bodies upright when we are sitting and standing. Here changes in muscle tone normal in early stage and diminished in later stage. Deep tendon reflexes early stage diminished and later stage is absent. Next, pain. It cannot affect sensory nerves, so there is no other symptoms. However, muscle pain may be present in certain cases of inflammatory myopathy and infectious myopathy, which leads to inflammation in that muscles. Exercise induced myalgia. Myalgia means pain. It is presented in metabolic myopathy. Next, myotonic reaction or failure. Myotonic reaction or failure or inability of muscle to relax after contraction or after activity. These myotonic reaction is characteristic of myotonic myopathy. Suppose you will shake the hand of myotonic myopathy patient, the patient will not able to release like the hand of shaking. He need sometimes before his hand to relax. Next one is con- contracture. It is seen in chronic myopathy condition. The contraction can be due to continuation of abnormal portion or would be due to that full of gravity of weak muscles. Next, various diagnostic test. First one is laboratory evaluation. Now the most common blood test that used for suspected case of myopathies: serum CPK level, serum creatinine phosphokinase level raised in acute inflammatory myopathy and early stage of Duchenne muscular dystrophy and Becker muscular dystrophy. When active muscle cell destruction, the time serum CPK level are raised 100 to 50 to 100 times raised. It is not a diagnostic test, it is a confirmatory test. Serum CPK level is the confirmatory test. Serum's CPK within normal limits in chronic inflammatory muscle disease, slow progressive dystrophy, and conjunctival dystrophy. Second test name is called as electrodiagnosis, where we will do MNCV, motor nerve conduction velocity, and EMV, electromyography. Third one is muscle biopsy. Muscle biopsy under anesthesia, small amount of muscle tissue is extracted and it examined under microscope, and this histopathological examination help to determine the type and extent of muscle disease, whether inflammation, whether dystrophy. So common biopsy site include biceps, deltoid, quadriceps and gastrocnemias, biceps, deltoid, quadriceps and gastrocnemias. Next, genetic studies. Genetic studies very help in hereditary myopathy and help that family to make decision regarding prenatal diagnosis and future planning of pregnancy. It help who is carry whether the disease transmit to the mother or father. Now coming to complication, respiratory complication, it causes due to direct involvement of respiratory muscles, may be weak in myopathy. There can be spinal muscular weakness and there is restricted thoracic mobility due to that spinal deformity. So what is the result or impairment? Reduced lung expansion, the lungs tissue collapse, so they do not expand, they leads to collection of fluid, so more chances to chest pain, weak cough, also chances for aspiration pneumonia. All this leads to respiratory complication. Next, cardiac complication. Cardiomyopathy and heart failure are common in muscular dystrophy as well as myotonic dystrophy due to direct involvement of cardiac muscles. So heart problem are greater in PDM than DMD. Approximately 70% of boys with PMD have cardiac involvement by the age of 20. So there is increased incidence of sudden death in patient with myotonic dystrophy type 1. Obesity due to lack of physical activity, sleep disturbance, lack of wet mobility, and inability to turn in bed. Then osteoporosis, bone loss because of calcium, and spinal deformities. These are the complications. So this video discussed about myopathy, a disease of muscles, two types, hereditary and acquired. Thanks for watching.